Hi everyone, I am Dr. Waseem Sajjad. I am a diagnostic and interventional radiologist, and today we are going to discuss about breast imaging, the different radiological modalities used for breast imaging, the different pathologies of breast, and how these different pathologies of breast affect and distort the normal anatomy of the breast on different radiological imaging modalities like breast MRI, breast CT scan, mammography, breast ultrasound, and PET scans. This lecture is very important for breast surgeons, breast imaging radiologists, breast physicians, breast oncologists, general practitioners, and the patients who are suffering from different breast pathologies, especially breast cancer. Now let's move to the computer screen to understand the different imaging modalities which are used for breast imaging and how normal breast appears on these different imaging modalities. But before going to the screen, I would like to request you to subscribe my channel so that you can learn the coming topics in detail, and don't forget to hit the bell icon. First of all, quickly let's have a general brief overview of the breast. We all know that breast is a conical, round or hemispherical shaped organ. It is composed of about 15 to 20 lobes, and each lobe is encased in facial sheath, and this facial sheath is defined by anterior mammary fascia and posterior mammary fascia. We will see it in the coming slides. The breast extends from second or third intercostal space to sixth or seventh intercostal space. Laterally, it extends to the anterior axillary fold, and medially, it extends to the lateral border of sternum. If we think of its relationship with the chest wall, we see that superior two-thirds of the breast overlies pectoralis major muscle, the lateral portion overlies serratus anterior muscle, and inferior most margin overlies upper abdominal oblique muscles. Sometimes the normal breast tissue extends to the axilla, and it is called axillary tail of Spence. The average breast size is about 10 to 12 cm in diameter, and it is 5 to 7 cm in thickness. The breast tissue is supported by different facial attachments to the skin and chest wall, and these facial attachments determine the mobility and support of the breast tissue. This is the schematic diagram showing glandular architecture of the breast. We can see that it is composed of alveoli and ducts of alveoli called ductules. These different alveoli and ductules converge to a single terminal duct called intralobular terminal duct, and this structure composed of different alveoli and intralobular terminal duct is called a lobule. Now these different lobules converge to form a single duct called extralobular terminal duct, and this extralobular terminal duct then converge to subsegmental ducts, then it is converged to segmental duct, then the segmental duct forms a lactiferous sinus, which is a dilatation of the segmental duct, and eventually form the collecting duct. And the collecting duct opens at the nipple. These glandular elements are responsible for milk production and transportation of the milk to the nipple. Now, it was very important to understand this basic architecture of the breast because different pathologies affect this normal architecture. We also need to know how this normal architecture appears on different imaging modalities. This is a mammographic image showing zonal anatomy of the breast. The breast is divided into three zones: pre-mammary zone, mammary zone, and retromammary zone. Now this is the pre-mammary zone. The pre-mammary zone contains of anterior suspensory ligaments. Anterior suspensory ligaments are basically the fascial sheaths which attach the mammary zone to the dermis of the skin and provide support and stability to the breast. These anterior suspensory ligaments are also called ligaments of Cooper, and pre-mammary zone also contains subcutaneous fat. This low density area represents the subcutaneous fat and it lies within pre-mammary zone. So this is the mammary zone. Mammary zone we already discussed composed of fibroglandular tissue. This fibroglandular tissue is relatively dense than the fat in the breast tissue. Similarly, the retromammary zone is composed of posterior suspensory ligaments. These posterior suspensory ligaments are fascial sheaths which attach mammary zone to the chest wall, and we can see the most posterior is the pectoralis major muscle. So this is the mammary zone. This dense region represents mammary zone, and anterior to the dense region is the pre-mammary zone, and posteriorly is the posterior mammary zone, and the most posterior part is the pect major muscle and superiorly pect minor muscle. Now this is the ultrasound image, and we will understand how these normal anatomic structures appear on ultrasound. So the most anteriorly, this hyperechoic line represents the skin. Just beneath the skin is the pre-mammary zone, and pre-mammary zone we know is composed of subcutaneous fat, and interior suspensory ligaments are ligaments of Cooper, and this pre-mammary zone ends posteriorly at anterior mammary fascia, which appears as hyperechoic line. Posterior to this hyperechoic line is the mammary zone. Mammary zone is a fibroglandular zone and appears, and posterior to the mammary zone is the retromammary zone, and posterior to the retromammary zone is the pect major muscle and the pect minor muscles. Further posteriorly is the pleura of the lung, and this is the lung tissue. So this ultrasound image is representing different normal anatomic structures. This hypoechoic region is the lactiferous sinus. This is the normal nipple, and these are the normal ducts, appears hypoechoic. Now this is the MRI image of the breast. Breast MRI is one of the most important imaging modalities, and we usually perform T2 sequence and T2 stir sequences. We will study these MRI sequences in coming lectures, but here it is very important to understand that the density of fibroglandular tissue of the breast varies with the patient age, and it also varies according to the menstrual phase of the female. So breast imaging is usually performed during the follicular phase of menstrual cycle, because during the follicular phase of menstrual cycle, breast tissue is less dense and breast water content is minimal, and these features are helpful to diagnose the pathologies better. In breast MRI, we describe fibroglandular tissue, whether it is fatty, it is heterogeneous, or it is extreme intense. We also describe background parenchymal enhancement, whether it is minimal, mild, moderate or marked. And it is important to know that increased breast parenchymal enhancement predicts increased risk of developing breast cancers. I hope this lecture helped you to understand the normal imaging of the breast on different radiological imaging modalities, and in the coming lecture we will discuss the breast pathologies and their appearances on different radiological modalities one by one.